Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast for people with diabetes. The goal of our podcast has always been and continues to be to empower you with knowledge. Today we're going to be talking about immunizations. I'm your host, Dr. Neil Skolnik, Professor of Family and Community Medicine at the Sidney Kimmel Medical College of Thomas Jefferson University and Associate Director of the Family Medicine Residency Program at Jefferson Health, Abington. Before we jump into our topic, I am so happy to introduce my new co-host, Lucia Novak. Lucia Novak is a nurse practitioner who specializes in diabetes and obesity and is president of Diabesity, as well as works with Capital Diabetes and Endocrine Associates outside of Washington, D.C. Lucia, it is a pleasure to have you joining our podcast as co-host.
Neil, I am equally as excited. It is really, really good to be here with you today, and I am so honored to do so. And I'd like to give a shout out to all of the Day by Day fans. You're in for a really good treat, I promise.
So, Lucia, immunizations are such an important part of routine health care, and the need for immunizations is particularly important for people with diabetes. Diabetes leads to a heightened susceptibility to some infections, as well as a higher likelihood of severe consequences of those infections if you do get them. Therefore, as important as proper immunizations are for all of us, they're even more important if you have diabetes. Lucia, let's go through the recommended vaccinations for adults with diabetes. We're going to leave to the side childhood recommendations. That's a whole separate topic. But let's cover immunizations for adults with diabetes, and we'll start with respiratory vaccines, starting with the influenza vaccine.
Yeah, absolutely. That's the one that everyone should have had by now. It's actually recommended definitely once a year, but typically we really encourage folks to try to get it before the end of October because of the 2 weeks that it takes the body to mount a response, as well as when we expect to see the height of infection. So we want to make sure that you have adequate protection on board. There are 2 ways this vaccine can be administered. One of them is the most common. It's the shot, which everyone calls it, of course, the flu shot. But there's also a live vaccine. So the flu shot is not a live vaccine. You're not getting live virus when you receive the flu shot. But with the nasal spray, that is live. It's attenuated. So it's live, but it's at a lower dose than if you were exposed to the actual virus. That is not recommended for people who have type 2 or type 1 diabetes because of your increased risk. So everyone with diabetes, regardless of age, is recommended to get an annual flu shot. Try to get it before the end of October. And yes, it's not 100%. Nothing in life is, but it will convey a greater protection. So if you do get exposed to the flu, hopefully you won't be as sick, because a lot of people, especially the very young and the very old, and in this country we call old anyone over 65, which is young, but just so you know, we still see severe illness, hospitalizations, and unfortunately death in those populations. So it really is important to get the vaccine.
Yeah, and Lucia, you mentioned those severe things, and a lot of people think of the flu shot as protecting them from that very annoying week or two of a cold. But our real intention is a lot more serious than that. And it has been really well shown to protect against things like heart attacks, strokes, and as you said, hospitalizations and death, particularly in vulnerable groups. So it's really important. And even though the match isn't always perfect to the circulating strain, if we look back over the last decade, It's been a very important part of our routine healthcare, and it has been very effective. Now, something I hear a lot from patients, not everyone wants to get their flu shot. And the two things that I hear most commonly as reasons why is one, whenever I get the flu shot, I get sick right afterwards. And the other thing I hear from people who don't want to be vaccinated they say, well, I never get the flu anyway. Why do I need a shot? What's your advice to people who have those thoughts?
The thing about I get sick when I get the flu shot. So again, you're not getting the flu when you get the flu shot. Your body is recognizing the virus. And what should happen if you actually don't feel well after you receive your flu vaccine, and you're not going to be horribly sick, but you might have some body aches, you might notice not feeling quite right, maybe a little fatigue that lasts for a couple of days. That's proof that your body is mounting a response. So that's actually something we would like for you to experience, so that we know that you're going to do better when the flu season is really at its peak. As for people who say, well, I've never gotten sick before, as a nurse practitioner, and my family will attest to this, I oftentimes don't feel ill myself, but then everyone in the house is ill around me. And it's usually because I'm maybe a carrier to things. And so you have to be mindful, not just of your own vulnerabilities, and people with diabetes have vulnerabilities with their immune system. But as we get older, those vulnerabilities may progress. So where you may not have had issues when you're younger, as we continue to get older, that changes. But you also need to be considering the people around you in your home, especially, that maybe don't have the resilience that you may have. And protecting yourself will also help protect them.
Such important points, Lucia. Let's see, what should we talk about next?
Well, I would like to really talk about the newer one, because that's the next question I seem to be getting a lot, is the RSV. If they get the letters in the right order, it sometimes is RVS, but the newer vaccine, if you
Yeah.
can talk a little bit about that one.
Yeah, so RSV stands for respiratory syncytial virus. And a lot of people go, what happened here? I never heard of that before. Is this like something new they invented? Well, it's not. Those of us who have taken care of kids have been aware of RSV for years. We used to think it was primarily an illness that only young kids get. When I say young kids, 2, 3 months of age to about 5 years of age. And as a family doctor, I've admitted and taken care of many kids with serious RSV in the hospital. Then, about 10 to 15 years ago, we discovered this wasn't just a virus that kids get. Turns out that a lot of older adults get that virus, and it can be very dangerous for older adults. And as we should have known all along, because even when I was a resident on the pediatric wards, somehow RSV season, all of us got upper respiratory infections. Adults get RSV and transmit it to one another, but it can be particularly a dangerous infection in anyone who is vulnerable. Who are those vulnerable groups for whom RSV vaccine is recommended? Well, that's everyone over 75. Age makes you susceptible to serious consequences of almost everything, including RSV. So it's recommended that you get the RSV vaccine if you're over 75, and if you're between 65 and 75, if you fall into a group that has increased vulnerability to serious infection, and people with diabetes are in that group, as are people with asthma, as are people who've had any previous cardiovascular disease or kidney disease. And the recommendation here is just a single dose of the RSV vaccine. You don't need another dose in subsequent years yet, though I suspect at some point we will see that immunity does wane over time, and there will be recommendations in the future about the frequency for repeat doses. Right now, you need it once. So, Lucia, can you briefly now go over the next respiratory illness, but briefly, because we could spend a whole session talking about COVID, but just briefly, what are the recommendations for COVID vaccination?
So that's a great question about COVID. It's really evolved from when it was initially put out, where we needed to get a series of vaccines, one right after the other, a few weeks apart. Now we are really encouraging people to at least get it once a year.
Excellent. Why don't we now jump into a really important one, which is the pneumonia vaccine? And it's interesting. It's called a pneumonia vaccine because the bacteria that it immunizes against is actually called Streptococcus pneumonia. That's its name. And while it is the most common cause of bacterial pneumonia, that's not the real or only reason that we recommend vaccination for pneumococcal disease, because the pneumonia can lead to what is called invasive pneumococcal disease, meaning that bacteria gets into your bloodstream, and it turns out that it's a significant cause of disability and death in vulnerable groups. Again, who is vulnerable? This reminds me of the movie Casablanca, where in the end, I believe they said, round up the usual suspects. And, it's older people with cardiovascular disease, kidney disease, asthma, COPD, any immunosuppressive illness, and diabetes or severe obesity. And it is recommended that you get the pneumonia vaccine. And here's something to remember. If you got it years ago, that was with a different pneumonia vaccine, something called a polysaccharide vaccine that didn't last as long and give as good of an immune response. We have now what are called the conjugated vaccines. There's two different types out there. There's what's called a PCV20 and a PCV21. Your healthcare clinician can recommend which one to get. The key is to get one of them. If you have diabetes, it's one of those really serious illnesses, whether it's for pneumonia or other invasive disease, that you just don't want to get if you can avoid it. And there's a pretty clear-cut way to avoid it. Let's now turn, Lucia, away from the respiratory illnesses to something completely different. Can you tell us about hepatitis B?
I would love to talk about hepatitis B. And the reason I have this passion right now is we've really come to appreciate that there is metabolic dysfunction associated fatty liver disease in people with diabetes, especially in those that have comorbid overweight or obesity, where it's right around the middle. And the thing with that is that leads to significant liver damage, cirrhosis, liver cancer, and death. And so when we talk about the hepatitis vaccine, yes, it protects us from hepatitis, which is a bloodborne type of an infection. So unless you're exposed to a needle or drug use or sexual partners that maybe have it and you don't have the vaccine, you could get it. So there's, certain reasons we do it, and every newborn will get it because they're more likely to get it within the first day or so of being born. But in people that develop fatty liver, that risk for liver cancer and cirrhosis is actually quite high. And the hepatitis vaccine can protect you against liver cancer and liver disease. And if you were to develop or acquire any issues that made you ill as far as your GI tract is concerned, where your liver was at risk, if you don't have that vaccine on board, you're actually at a much greater risk of having severe illness, potentially fatal. So it is something that we really want everyone to receive. And it is one of those that requires a series. Typically, it's 3 injections. And then you are good for a lifetime. So if you've had these, many of us in the United States have had these vaccines as a child growing up. Many people who are former military did get those vaccines as well. So many of us do have that protection, but there are a lot of folks that may not. And we really encourage you to get those vaccines because we want to protect the liver. So, Neil, I think the next one we want to talk about is what I've seen those horrible commercials for with the red, angry rash on the body, and everyone knows what shingles is. Can you tell us about the shingles vaccine?
Yeah, this is an important one, Lucia. And you're right. Most people have seen those pictures that are kind of scary looking, and it's a kind of scary disease. The medical term is zoster, the common term is shingles. And it's not that we just want to avoid an unattractive looking rash, but we want to really avoid the consequences of that rash. And the consequences of that rash quite often are serious pain that goes along with the distribution of that rash. And, if the pain only lasted a week, which is about how long the rash lasts, we wouldn't worry that much about it. But the pain can last a long time, anywhere from weeks to months or even years. And it's described as lancinating and lightning-like and electric shock-like. All those descriptions make it clear that it's something that we want to avoid if we can. And so the recommendations are, if you're above 50, you should get the shingle shot, the zoster vaccine. And that's simply 2 shots. It's a shot when you first get it, and then at anywhere from 2 to 6 months later, you get the second shot. If you forget to go in at 6 months, you end up there at 8 months, 10 months, a year. That's okay. You don't have to restart your vaccination. As long as you get that second shot on board, you're good. Lucia, any others we should think about?
Probably the Tdap or the tetanus, diphtheria, pertussis one is a good one to talk about. That one is not as commonly talked about because that, especially for adults, is typically once every 10 years, and that's because of the tetanus portion of it. But so there's the tetanus portion of that, which would protect you from getting an injury, so a deep, usually a puncture injury or exposed to dirt or something like that, where the bacteria actually survives. And if it gets into a deep wound like that, where it's difficult to clean, then we risk that that can become systemic and people will develop painful stiffness, clenching of their muscles to the point where they cannot open their jaw. And they also have difficulty breathing. So it can be a life-threatening illness from tetanus. The second portion of that, so it's a buy one, get 3 free kind of shot. Mm-hmm. So the diphtheria, that's something that we typically associate with younger. And so many of these diseases, we don't even see very much anymore because we have done such a good job with vaccination. So it's really important to continue. But we want to make sure that people are getting that vaccine as well, especially when they're younger. So that's something that I think there's a little bit of a wear off as you get older, which is why it's included with the tetanus vaccine. And then the third portion is the pertussis. That's the whooping cough that we all know about. And again, very contagious, airborne type of an infection, and we want to make sure that we are protected against that as well. So you get 3 for the price of 1. That one is once every 10 years. It is a painful one. That one goes deep into the muscle, but it's definitely worth having that rather than getting tetanus, which is really what the concern is.
Yeah, that's right. And I often think about pertussis in the context of if you have a grandchild coming. It's nice to have the pertussis on board because you don't want to bring pertussis into a household. I thought, Lucia, your point earlier about that it's not, we get vaccinated a lot of times not just for ourselves, but also to protect the people around us is such an important point. We're about out of time. Lucia, any final thoughts for our listeners?
My final thought for all of you is please make sure that you are up to date on your vaccines. If you have questions or concerns about them, please talk about it with your healthcare provider. Between the two of you, you should be able to come up with a decision that makes sense.
That's so important. And, there's so much differing information out there now. It's really important to go to a credible source. The American Diabetes Association each year looks at this information very carefully and then publishes its recommendations. The recommendations are consistent with the CDC's recommendations, and bring this up proactively with your healthcare provider. When you talk to your nurse practitioner, PA, or doctor, the truth is we're often very busy and we're focused on making sure we talk about your feet, your CGM, your blood glucoses, what medicine you're on. And hopefully we're also focused on vaccines, but if and when we're not, again, our goal here is empowering you with knowledge so you can take charge of your own healthcare, and you now have the knowledge that really is helpful for you regarding the importance of vaccines as one of the great public health successes of the century. Lucia, it is always a pleasure talking to you about medical topics.
Thank you, Neil. Likewise, and everyone, take care of yourself and each other.
Thanks, Lucia. It was a pleasure doing this episode with you, and I am so looking forward to co-hosting the series with you in an ongoing manner. To our audience, we hope this episode has given you practical information you can use. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for listening.